My name is Tasha Bennett, and today I will be giving a persuasive speech on the defunding of Planned Parenthood, on why we should not defund Planned Parenthood. Planned Parenthood is a nonprofit organization that provides affordable reproductive health care services in the United States and globally. In October of 2016, Planned Parenthood turned 100 years strong. Planned Parenthood was founded on the revolutionary idea that women should have the information and care they need to live strong, healthy lives and fulfill their dreams. There is about 600 health centers throughout the United States and operated by 59 independent local affiliates. Over 2.7 million women and men visit Planned Parenthood health centers annually. 1 in 5 U.S. women have been to Planned Parenthood at least once in their lives. With all the services Planned Parenthood provides and the success of the nonprofit organization over the years, it has gained a spotlight in the news. Planned Parenthood's most popular controversy is that the government should defund this organization. One debate is abortions are morally wrong. Pro-life advocates say that abortions are morally wrong because it is taking another human's life. Pro-choice advocates, on the other hand, say just because something has a potential for life doesn't mean that it is a living being. Pro-life advocates do not want their tax dollars being spent on something that they feel is immorally wrong. The other debate is some conservative politicians claim that they saw a secretly filmed video of Planned Parenthood employees in discussion of a fetal tissue for profit. Federal law forbids the sale of fetal tissue, but allows donations and small reimbursements for the cost of the procedure and donations. Although evidence has shown that the video was heavily doctored, however, suspicion is still strong for those wanting to shut down the government funding for Planned Parenthood. I will share why Planned Parenthood is a valuable organization to ourselves, community, and our country. Planned Parenthood is valuable to ourselves because it provides high quality, affordable health care and is the leader in providing teen sex education. You can get tested and receive treatments for STDs. You can receive cancer screening services. Planned Parenthood also provides hormone treatments for the LGBT patients. It also provides you with family planning services such as birth control, the morning after pill, and pregnancy tests and free condoms. Planned Parenthood is valuable to our community because it provides safe reproductive health care services that is reliable and affordable. Planned Parenthood provides teenagers with information about puberty, safe sex, preventing pregnancy, and unwanted relationships. Along with the doctors and nurses, Planned Parenthood health centers have counselors, social workers, health educators to help with parenting skills such as breastfeeding. Planned Parenthood even has a hotline you can call or text at any time, and it is staffed by sex educators. Planned Parenthood promotes research and the advancement of technology in reproductive health care. Partnered with the Planned Parenthood Center of Outcome Research, and their focus is on research that has the potential to improve health care and outcomes for millions of individuals and their families. Recent and ongoing research includes a randomized trial on self-injectable birth control shots, which would allow women to self-administrate the injection, minimizing the barriers of having to travel to clinics every couple months to receive a birth control shot. Another example is researching the development of new methods for measuring high-quality contraceptive care. Planned Parenthood is valuable to our country and economic growth. With hundreds of healthcare centers nationwide, it provides jobs to thousands of healthcare workers and administration workers. If these centers were to get shut down, our unemployment rate will go up, leaving thousands without a job. Millions of healthcare services will not get provided if Planned Parenthood was to close its door. In 2016, Planned Parenthood provided services to 2.4 million patients and 9.5 million services were provided. With these numbers, patients would not get in to any regular clinics soon enough if they had to rely on a regular healthcare provider. Doctor clinics would get so many visits that they would not be able to provide the quality care that Planned Parenthood already provides. Lastly, our government spending will increase because of more Medicaid births to low-income families who cannot receive affordable contraceptives. The more children born to low-income families will result in those children remaining in poverty during their life. The additional births would have to be covered by Medicaid, as would the needs of the children as they grow up and potentially rely on other welfare safety nets. Given all of those factors, Medicaid spending alone would increase by $650 million over 10 years, according to the Congressional Budget Office. Overall funding for the family planning services is actually cost effective. For every dollar spent on providing birth control, it saves the federal government $3.74 by avoiding unwanted births. Unplanned pregnancies also come at financial cost to women who have them. Studies have shown women who were not able to obtain abortions were 3 times more likely to be on welfare. Among women who seek abortions, the number one cited reason for having an abortion was simply because they cannot afford financially to have a baby. In conclusion, Planned Parenthood should keep its federal funding. This funding allows the organization to continue providing reproductive health care services at a reasonable, affordable cost. If they do not have funding, then more clinics will have to close simply because they cannot afford to stay open, leaving millions of men and women without family planning services. Men will not receive cancer screenings, STD testings and treatments, vasectomy counseling and referrals. Women won't receive birth control, yearly pelvic exams, and pregnancy tests. Teens will not have a safe place to discuss safe sex because they are too scared to confront their parents because they are sexually active. Many LGBT patients will not receive hormone treatments and HIV screening and treatments. Older women will not receive information on menopause, on how to cope with menopause. Planned Parenthood opponents argue that Planned Parenthood only provides abortions and it should be defunded because the abortions are morally wrong and they do not want their tax dollars going towards abortions that they have little to be concerned. Planned Parenthood does not use its federal funding for abortion services. Planned Parenthood funding is from Medicaid reimbursements for preventative care and from some Title X. At least 60% of Planned Parenthood patients rely on public health programs like Medicaid and Title X. Planned Parenthood is valuable to ourselves, our community, and our economic growth. Defunding this organization will have a drastic impact on everyone.